In my last video, we discussed why rheumatology may not be the most ideal specialty to evaluate and treat your hEDS or HSD. So I wanted to follow that up with some practical tips on how you can find a doctor that can help with these conditions. Generally speaking, there are certain specialties within Western medicine that I tend to recommend more so than others, simply because their background and training allows them to more fully understand the complex pathophysiology of hEDS, as well as how it interacts with the neuroimmune axis to cause various symptoms. For those with primarily musculoskeletal concerns, my top recommendations would be physiatry, neuromuscular medicine, interventional pain, and really any DO that actively practices OMM or OMT. Orthopedics and sports medicine might be helpful as well, though in my experience, they're not necessarily as interested in digging deep into the diagnostic side of things. Medical genetics can be really helpful for diagnosis in particular. However, they don't typically offer long-term treatment. If you're dealing with POTS or any type of dysautonomia, I would also highly recommend neuroimmunology, although I understand those can be quite rare and hard to find. Both neurology and immunology as separate specialties can be really hit or miss with these conditions, but I will say an EDS-informed neurologist or immunologist can be an amazing addition to your team. Neurogastroenterology is also one that I highly recommend, though again, these are rare. Regular GI docs can also be quite hit or miss, although I find that most patients that are experiencing GI symptoms end up needing to see at least one so that they can do procedures like colonoscopy and endoscopy. Urogynecology or regular OB-GYN can also be quite helpful when it comes to pelvic concerns like excessive bleeding, chronic pelvic pain, or pelvic organ prolapse. For vascular issues like compression syndromes, venous reflux, pelvic congestion syndrome, a vascular surgeon can be really helpful, as well as an interventional radiologist. As an internist myself, I would also love to see a lot more IM and family docs become more EDS informed, because I think our training and background really does make us pretty well equipped to diagnose and manage many components of hEDS. Though honestly, the biggest hurdle that I'm seeing in primary care right now is simply the severe time constraints that many PCPs are under, which makes proper management of complex conditions nearly impossible. If you have the opportunity, finding a local direct primary care physician can honestly make a huge difference. I also generally recommend checking with your local support groups and local FB pages to see if there are any local doctors that are already known to be EDS informed. And last but not least, don't forget about those online directories like EDS Society, Dysautonomia International, ME Aware, or really any directories that might be specific to the conditions that you're most concerned about.